Hey everyone, this is John Fortner right here and Tom Miller.
Hello.
We're getting together on this video to talk about some of the basics that you need while first presenting Silverlon. And with these videos, we're going to do about a 5 to 10 minute snippet of some of the stories that are key stories that Tom has been developing and using over the past several years in selling Silverlon, and they're going to be critical to being able to convey the message to our customer, you know, what's important to them about Silverlon and how it's going to affect their outcomes. What does it mean to them if they use Silverlon Lifesaver for their IV catheter site dressing? So this is pretty informal, and we're just going to go through some of the supporting material in the first video and try to help out where we can as far as leveraging what Tom knows and being able to use his experience so that all of us can be successful and get up that learning curve just a little quicker. So with that said, I'm going to point the video towards Tom, and we're going to just start talking about some of the things he uses to set up the calls. And then in the second video, we'll probably talk about some of the studies. In a third video, we'll talk about some of the conduction stories and so on. So just to prepare you, what we're trying to do is just trying to get another tool through this video to help everybody get up the curve, learning curve a little quicker. All right, so Tom, I'm going to turn it over to you. And I guess what we really want to cover is during the first call you're making with a clinician you don't know, what are some of the first things you do to kind of, you know, open up the call, and what props do you use, what things do you have in hand that you know that you're going to talk about and have a
all right, I got it. Normally, not knowing our customer's interest or bias towards chlorhexidine, gluconate biopatch, or one of the other silver products, be it the Royal Elgidex AG, I have our normal brochure, right? I have our skin physiological response that John just took from me, which is some of the things that we went through before. I always have the actual product in my hand because folks are used to seeing the impregnated dressings, which normally look just like this or they're off color. Here they can actually get a feel for the metallic silver, which is part of the story that we'd like to build upon. I always have, maybe not this large a swatch, but I always have one of our 2x2 or 4x4 silver contact dressings, which allow them to play with the cloth. They'll always find it's comforting when they touch it, for those of you who've opened up the little 2x2s I've given you in the past. And then I always hand out, as with my calling card, a couple of these adhesive strips. And the story we build around this is helpful, particularly if we get down the road in a presentation and someone says, I don't have catheter-related infection problems, we can then sometimes move the story to the conductive story, this being metallic silver that's highly conductive. We hand these out and we tell people, you know, if you bring these home and you get a grease splatter, those little burns hurt for about 20-30 minutes, and then they usually blister and they stay discolored 6 to 7 days. If you had this in your kitchen drawer and you burn yourself and you put a few drops of water on the silver, it's the same silver that's here, which is the same silver that's on this, what you'll notice is you'll be in less pain or no pain within 2 minutes after you put this on. You can take this bandage off, the pain will come back, put it back on, the pain goes away. That's reconnecting what they call transepithelial potential, skin potential. I like to give these out because it's the least expensive thing we can hand out, right? And they usually bring these home when they're less preoccupied with work. So we'll get into that story. Those are at least the 3 products I like to have in hand. And then we move into what I like to tell people is I like to disarm them, right? Over the last 5 years, infection control has implemented a lot of different protocols. And they've been doing a pretty good job lowering the infection rate from where they were. And many of them will say that they have, but a lot of times I like to acknowledge that. It disarms them. And then I like to say that, you know, but we all need a little more help, particularly when you have a sicker patient, immune compromised. They're going to be in the hospital for a while. We all need a little additional help. I like to say, over the last 5 years, you've implemented those little stat lock like fixators, or what they call stabilizers, onto a catheter so there's less slop in it. If there's less slop, there's less phlebitis, there's potential for less infection. They've practiced sterile technique. They're getting the hang of how to use their skin preps, the 30-second scrub, and then a 2-minute wait, and then the introducer. They're doing a lot of things right. And most of them will admit they need a little more help, and they'll also admit that their infection rate's kind of like a roller coaster. They might not see them for months, and then they'll have a few. So first thing I like to do is say, you've done a good job, and there's still some work to be done. And then I say, have you been using the BioPatch? And many of them are going to say yes, it's the #1 product as a cover dressing with a film dressing on top. And I'd like to say, can you tell me with really any amount of assurity that the BioPatch contributed to that lowering trend? And most of them will say, no, they're not too sure, because they've implemented all these other protocols all at about the same time. Most of them will say, we think it's helping. And I'd say, well, that's great. Now, what I'd like to do is introduce you to the Silverlon Lifesaver AG. The difference between our products are this: chlorhexidine gluconate, be it the BioPatch or 3M's Tegaderm CHG, or any of the other silver products that I listed on our one sheet that talked about, it was a Dr. Thomas study, the concentration of silver in these things. I also mentioned Silversite by John Centauria. Their product's called Silversite. That's an impregnated silver ion product. There's Elgidex AG by DeRoyal, which is an impregnated silver product that kind of has a rubbery film on it, which is what they impregnated the silver into. You're going to run across, and be promoting the Silverlon. I like to say there's a difference between the impregnated products, be it chlorhexidine or silver ions, and metallic silver.
Hey, Tom, let's hold. I'm going to go ahead and turn off the video and then do another video for that actual story. So that's a good introduction to where we are right now. Okay. So guys, that's I'm trying to cut off.
I'm being lectured.
No lecture here. Just what we want to do is to do this in snippets, so you can watch a 7 to 10 minute video and then summarize it in your head, because those are the basics that he talks about at first. Now the next video is going to be on impregnated. What is the difference between impregnated and plated silver? So that's really the first story that you're going to tell.